If you remember, when we were kids, we'd get a balloon and you'd play with it over and over again, blow it up and let the air out, and blow it up and let the air out, and you try to blow it up bigger and bigger. And eventually that balloon gets very stretched out and kind of floppy. And then at some point you fill it up too much and it's become so weakened that it just breaks. And that's what happened to the alveoli after a while. And when this happens, there are big areas where there are just ruptured alveoli and the air can't do what it's supposed to do. It can't exchange oxygen for carbon dioxide. And so once again, patients have a hard time breathing out, but not because everything is constricted, so much as there just are no areas of perfusion left in large parts of their lungs. And here is a picture of that. You see on the top, we see the healthy alveoli, like bunches of grapes, surrounded with capillaries, and that allows a lot of areas for perfusion and for oxygen and carbon dioxide to exchange. And with emphysema, the emphysema part of chronic obstructive pulmonary disease, you see that there are just big dead spaces where there is no exchange of oxygen and carbon dioxide. And people with COPD actually get used to a higher amount of oxygen or a higher amount of carbon dioxide in their blood because they're not as able to blow as much off. And so they become CO2 retainers, and that means that their entire body gradually becomes more used to a higher level of CO2. And they're always going to be a little bit more acidotic when you check their arterial blood gases. In fact, you can kill a COPD patient by giving them too much oxygen because they have gradually become so used to a certain level of CO2. Here is a nebulizer treatment, many times given in a clinical setting for treating asthma or COPD. And a lot of times they'll send people home with nebulizers, especially if you have children who've been treated in the ER and then, they turn out to have asthma or some other sort of respiratory condition. They'll just send you home with a nebulizer and give regular breathing treatments at home. So let's talk about some of the different kinds of medications that you might take for asthma or COPD. And of course, the most common types are the bronchodilators. Now, there are two types. There are short-acting and long-acting. And we will talk about both of those types. So the first one we're going to talk about is short-acting. They're short-acting beta agonists. That means that these medications occupy the beta receptors of the sympathetic nervous system in the respiratory system, and by blocking or by occupying those receptors and allowing them to work like epinephrine and norepinephrine, you've got the muscles relaxing and dilating. The vasoconstriction of blood vessels are going to decrease that edema. You're not going to have that swelling, and that's going to open up those bronchial passages a little bit. So inside they won't be inflamed, and then outside the muscles will be smoothed and dilated. They're going to increase the rate and force of heart contraction, so your heart rate and blood pressure are going to go up. These medications work very quickly, so they usually refer to them as rescue inhalers. For people who are prone to acute asthma attacks where all of a sudden you're going to react to something, you really want to carry one with you all the time if you're an asthmatic or somebody with COPD, because when you are fighting for air, you want everything opened up pretty rapidly. Now, the prototype medication is albuterol, and it goes by the trade name Ventolin, and it's going to be mostly in inhaler form that you can carry around with you, although it is available in nebulizer treatments and usually given with steam or humidified air. You can take care of fast-acting kind of bronchospasms that come on you all of a sudden, whether it's from asthma or bronchitis. Sometimes people will have an upper respiratory illness that sort of advances down into the lungs and everything gets swelled up and infected, and the healthcare provider will order albuterol inhaler for short-term use, even though the person isn't going to have a lifetime issue with it, unless it's chronic bronchitis. And then COPD, we can at least, even if the alveoli are destroyed, you can at least keep those passages open so that the person can get what benefit from the alveoli that are left. Now, we are going to be talking about long-acting beta agonists, like Ceravent and one of the ingredients in Advair. Those you take every day to give yourself long-term protection, and it works slowly. Kind of like the Chromalin inhalers that we talked about previously. They're not for acute asthma. You are not going to save your life by huffing on your Ceravent. You've got to keep the albuterol. Ventolin or Proventil is another name, and there's some others. Now, these inhalers can cause a bad taste in the mouth, so usually you want to rinse your mouth out after you've taken your puffs of your inhalers. Some of these medications come in the form of anticholinergics. They're acetylcholine antagonists, and a prototype of this would be ipratropium or Atrovent, and that blocks cholinergic receptors, and that acetylcholine, remember, is going to constrict the airways as your body returns to normal after a fight or flight reaction. But sometimes the acetylcholine will overreact and constrict the airways too much. And by taking these long-term anticholinergics, it will prevent that and keep that smooth muscle more dilated. So the uses of the ipratropium or Atrovent would be to cut down on all those respiratory symptoms with asthma or COPD. They use it a lot for COPD. It's a little bit more effective. This can cause sore throat, can make your nose stuffy, and because it functions as an anticholinergic, some people will find they get constipated with Atrovent use. This is discussed on page 117, table 7.4, if you want to. No, not if you want to. You need to read about it and read the nursing implications. Now, an old school kind of bronchodilator, they were used for years and years and were even in some over-the-counter medications, but that's been stopped, are the xanthine bronchodilators, and I'll talk about those in a minute.